A man has breasts, so a man can have breast cancer.
Wow.
It is very rare for breast cancer to be good. Breast cancer is painless.
Wow. So the thing is very subtle.
Yes.
Mentality of saying, I don't have a family. You know that we don't have anybody. And some we say not wearing bra is a way of preventing that. When you wear bra, the ions and some of those, there are so many things. So I don't know. You are an expert in this, so let us know which is true, which is not true actually.
Okay.
Hello guys, welcome to Shrin's Health Podcast, your best bet on health related tips. I am Debbie Mike and I'm super excited. As you all know, it's October and it is Pinktober. Yeah, we call it Pinktober because it's a month where worldwide we create awareness on breast cancer, and this is going to be a very interesting conversation. This is one that is really going to help a lot of persons out there. But before then, when you hear the word pink, you know how it's associated with ladies, feminine, and all of those things. And every lady, virtually every lady, wants their room to be decorated with pink, growing up, and all of those things. So that's pretty interesting. Although this has been narrowed down basically to people who are maybe survivors or victims of breast cancer. So to help with that, I have a wonderful person in the studio with me. He's a medical doctor, Dr. Aremu. Well, guys, he's a man, and I'm going to be wondering, so many of you will be thinking, oh, why is a man talking about breast cancer? Well, let's get started. You're going to learn a lot. So, Dr. Aremu, good to have you on the show. Good afternoon.
Good afternoon, everyone.
Good
afternoon.
Nice to be here. Thank you so much for joining us. How do you feel joining our podcast and getting to talk about things that, have to do with females?
I must say I feel very excited and I feel very impressed.
Okay.
Because these are things that we know that people need to know about. Yeah. People need to understand.
That's true.
We can't get tired of letting people know this. We can't get tired of creating the awareness surrounding breast cancer.
Yeah.
So I'm very happy to be here.
All right. Thank you so much. So let me ask you, on a personal note, are you a lover of pink?
Well, when I watch animations and I see a lot of pink color, it looks cool. But personally, I'm not a lover of pink.
All right, so we'll still give that to the ladies, right?
Yes.
All
but
right.
it surprises many ladies also. Black is their favorite
color. Yeah, that's true. Okay, so let's get started on the conversation. So when the word breast cancer is being mentioned, so many people do not really understand what it is, right? So I would want you to give us a little background as to what really is breast cancer.
So breast cancer, in a very simple term, is when the cells, some tissues in the breast, are growing faster and more than they should grow. And when you have a part of the body that is growing larger and faster than it is supposed to grow, that is cancerous. We call it neoplasm. It becomes consumptive. It consumes a lot of things in the body. It consumes a lot of nutrients, consumes a lot of energy. It invades tissues where it is not supposed to invade. So it grows more than the normal rate at which it's supposed to grow. All cells, our body is made up of cells.
Yeah,
just like we have been taught that all matters are made up of atoms.
Yeah.
The building block of our body is cells at the cellular level. So all cells grow, and at some point, many of these cells die, and they are replaced by another normal cells. So just like humans, we grow old, these cells, they grow old out of their function and they die. So, but when a cell that is supposed to grow and die now keeps growing, it is no longer dying, or those cells have gained the ability to be able to multiply more than they should normally do. That is what we call cancer.
Wow. Thank you so much. So going going with your response to what breast cancer is, I think that is why it's very important that there is more conversation around it. So many persons shy away from breast cancer. When you even try to talk to some person, they feel, I don't have it, I can't have it mentality. But it's best that you really pay attention to it, because it's something that can happen to anybody.
Definitely.
And in the course of doing some of my personal research for this podcast, I noticed that a lot of persons can be affected. When I mean a lot of persons, I'm talking about age.
Definitely.
I assumed it's something for, let's say, people that are in their 30s upward or thereabout. But I was shocked to see that so many persons below that age, 20, 22,
Definitely.
having cancer. So I don't know. Can you just talk a bit about that?
So when we talk about breast cancer, there are some common misconceptions that I feel we should try to debunk.
Talk about, yeah.
Misconceptions like only women have breast
cancer. Yeah, that's true.
A man has breasts, so a man can have breast cancer.
Wow.
Women have breasts, women can have breast cancer.
Mm.
But we have to put it out there that it is more common in women than men. So it is quite rare in men, but it occurs. Still last year, I'm aware of a patient, a male patient who died of breast cancer.
Wow.
A man. And I've had a colleague of mine who also lost his dad to breast cancer.
Wow.
So it happens in men, it happens in women, but it is commoner in women. So about 1 out of every 100 breast cancers is in men, while the rest are in women.
Wow.
So, and when it comes to age, yes, we can say it is commoner in certain age groups. Talk about people who are 30 and above. But we have to let you know that it can occur in every age group, any age group.
Wow.
Which is why when we talk about screening, we don't just leave it to certain age groups. We prefer all age groups to screen for breast cancer. I've seen breast cancer in a 21-year-old student. Breast cancer. I was shocked, really.
Yeah, it's so shocking.
Most times when I've seen breast cancer, it's always in women 40 and above. But I saw breast cancer in 21-year-old female. I've seen 27-year-old. I've seen people 30 plus, people 40 plus. So it can occur in any age group. But definitely, it is more common in people who are at least 40 years and above.
Okay. Well, thank you so much for that. So, to our listeners out there, whether you are a male or a female, there is possibilities of, being a victim of that, although we do not pray for that. And that is why we are having this podcast, to enlighten you and create the awareness about how you can be more careful and put yourself in check. So moving forward, what are the signs? Now that this can be common to be it male or female, and it's not a respecter of age, what are those signs that people should, pay attention to, that would give you a signal that I really need to put myself in check, something is wrong?
Okay. So when it comes to signs of breast cancer, I like to advise people that it is so that you don't even come down with those signs at all. That is why we want you to screen.
Okay.
That is the purpose of you screening.
Okay.
Doing these checkups. Because by the time you start coming down with the signs and symptoms of breast cancer, like, this is possible breast cancer.
Far, yeah.
It's already going far. It's already becoming advanced.
True.
So we advise that people screen.
Okay.
And there are different methods to screen for breast cancer.
Okay.
All right. So, but before we get to the different methods we can use to screen, but what are the signs when you are looking out for them? The signs that you are look at that may raise your suspicion. Oh, wow, that is this breast cancer, or what is going on in this breast? There are signs that you should see.
Okay.
And many of these signs, you will better pick them up if you are already conversant with how your breast looks and how your breast feels. Which is why we advise regular self-breast examination.
Yeah, that's true.
Doing that regularly may make you be more aware of many of these signs. Because if you are not doing it regularly, it is more likely that you miss them out. So what are those signs? For you realize that you look in the mirror, it looks as if Yes, it's possible, very possible normally for one breast to be bigger than the other. It's very possible. It is common. But now you look at the mirror, you realize there's a more rapid change in the size of one breast compared to the other, or there's a significant change in shape in one breast compared to the other. You realize it looks like, oh, there's a change in this nipple in one breast. Is it retracted or is it everted? So in the shape of the nipple, or you notice a discharge from the nipple that you feel is abnormal, or you are seeing some skin changes, and the skin, you could be puckering of the skin around that breast, around the areola, or of the breast tissue itself, or you have noticed the dimpling of the skin. There's something we call pod orange. If you've seen oranges, those little holes around oranges, and you now see the breast starting to appear like that. That was what we call pod orange. So you see those kind of skin changes. And commonly we have to know that let's not wait for, if I have cancer, it's going to be paining me. Breast cancer does not present with pain.
Oh, wow.
It is very rare for breast cancer to be pain. Breast cancer is painless.
Wow. So the thing is very subtle.
Yes. So it doesn't present with pain. But now you feel a lump and you feel like, because it's not painful, it's not breast cancer. No. Okay. If you are seeing redness of that skin changes, discharge, ulceration of the skin of the breasts, those should alert you and try to find out what exactly is going on. There may be pain in some complicated cases, but don't wait for pain for you to say, that is when you need to take action, because breast cancer is painless.
Wow. All right, thank you very much for that enlightenment. So now you are saying that those self-examinations and all of that is very important.
Very, very important.
So does it mean
breast cancer?
Okay, so does it mean we can just stand up, maybe as a lady, as a woman, and just always run to the healthcare center to be checked? Since we don't want to be victims of that, so I don't know, do we have to rush there to just be careful? Since you are saying you might have pain, you might not have pain, and all of those things.
Yeah, which is why we are doing this. We are trying to educate people.
Yeah, right.
Because number one, you have to know that there are different kinds of breast examination. There's what we call the self-breast examination. It is my breast. I'm the one examining my breast, checking my breast myself, which you can do at home yourself, right?
Yeah.
There's also what we call clinical breast examination. Okay. Which means a health practitioner examines your breast for you.
Okay.
So self-breast examination is good. It's not the gold standard for screening for breast cancer, but it is good because many people have actually had incidental findings of their own breasts like that. It is better when you are conversant with your body, conversant with your breast. True. It is more likely that you pick it up when something is going wrong, right? So self-breast examination, but you can also do clinical breast examination, which means on some scheduled visits, you go to the hospital and a health practitioner who also understands the anatomy of the breast quite well will examine your breast for you.
All right.
Though there are other methods of screening, which we can talk about in the progress of the podcast.
All right. Thank you. So before we move into another very important question, I would want us to talk about family history when it comes to breast cancer. I've read a lot about this. When I saw that everywhere, I was just seeing pink month. I wanted to be sure what was it about. So I discovered that some of the stories I read, some videos I saw, most of them do not have breast cancer related issues in their family background, but they are still victims. They are now carriers. So does it mean the mentality of saying I don't have a family, that we don't have anybody. So you can imagine that. So that alone is a mentality people carry, and because of that, definitely. Even if something is wrong, they might say, oh, it's boil. It's, those kind of thing. So how do we, talk about that?
Yes, when it comes to breast cancer, there can be a genetic underlying to breast cancer,
Okay.
right?
Yeah.
And when genetics is involved, we can have family history.
Yeah.
But believe me, 90% of breast cancers are sporadic, which means these are people that never even had
Have
a family history
history.
of breast cancer. But they just have it.
Wow.
So there are some people at about 8 to 10%, there can be some family history, genetic, and they have a mutation in their family that predisposes them to having breast cancer. But in 90% of people, any member of their family never had breast cancer. Not a first degree relative, talk about their mother or their father or siblings. And in some of them, even their more distant relatives never had breast cancer. But they come down with breast cancer. You don't have to have a family history of breast cancer to come down with breast cancer.
Wow.
But the family history of breast cancer places someone's at higher risk. It places the person at higher risk. But it is not essential that the person has to have a family history of breast cancer to come down with breast cancer. As about 90% of cases, that is actually not the case.
Wow. All right. Thank you so much. So moving forward, how important is early detection? And then you mentioned about two screening methods from our previous conversation, self-examination and clinical screening, right?
Yes.
So how important is early detection for either male or female? And then what screening method should women let me not narrow it down to women alone now, but though we are talking more for the women, so what screening method should people prioritize more to be able to enable them detect if there is a sign of breast cancer?
Okay. So to enable them detect if there is a sign of breast cancer, both men and women, self-breast examination is cheap. That's what they can do on their own.
Okay.
So we advise that they do it.
Okay. So they prioritize that.
It is your body. You are very familiar with your body. So do it.
Okay.
But for what should be prioritized now, it depends on, which one is the best screening method for us to screen for breast cancer.
Okay.
I've talked about self-breast examination. I've talked about clinical breast examination.
Yeah.
But there's what we call mammography.
Okay.
Mammography is basically us trying to use X-rays, low-dose radiation, to try to take a picture of the breast.
Okay.
And try to see if there are any changes in the tissue of the breast that may suggest cancer.
That one is more faster and
it is faster and we call it the gold standard for screening, actually.
Okay.
Because we realize that self-breast examination and clinical breast examination can be subjective, which means depending on who is doing it. I may do it and be able to pick things up faster. But someone else may do it and may not be able to pick it up. Though it's still beneficial, they do it. But from certain ages, we prefer that people do routine mammography.
Okay.
They get a mammogram done. They help them take a picture of their breast maybe every 2 to 3 years. In some clients, they do it yearly. So you get a picture of your breast taken, and it is reviewed for you to know if there are any signs in that breast that may point to cancerous changes, and a quick action can be taken. So early detection is very, very important, because early detection of breast cancer, it doesn't just become stage 4 in a day. Because when we talk about cancers, they are in stages. From stage 0, stage 1, stage 2, 3, 4, like that. So it doesn't become stage 4 or stage 3 in one day. It starts from some changes that are not even noticeable. But if you can pick this up early with mammo, it improves the person's chance of getting a cure, number one, and it also improves the person's chance of survival. So
Okay.
early detection is very important. But what we have seen often in this part of the world is that people present very late. People present very late. Even some that you are even lucky to, okay, maybe you are able to catch it up at an earlier
Early
stage.
stage.
Some would reject treatment. Okay, like we might have to do a mastectomy for you. Mastectomy is cutting away the cancerous breast.
Okay, so thank you so much for that wonderful response to that. So, moving forward, what are the common risk factors for breast cancer, and then how can women reduce their risk?
Okay. Common risk factors for breast cancer. So when we talk about risk factors for breast cancer now, we have what we call modifiable risk factors
Okay.
and the ones that are non-modifiable.
Modifiable. Okay.
Non-modifiable meaning that these are things that are not within your control anymore. These are things that you can't really influence anymore. Take for example someone that has a genetic underlying for breast cancer.
Yeah.
Maybe has a BRCA1 mutation, a BRCA2 mutation, or a mutation in one of the receptors, or two new receptors that predisposes the person to breast cancer. So your gene is not something you can change anymore at that stage. It is already a part of you. So for example, in the case of Angelina Jolie,
Okay.
she has a strong family history of breast cancer. Her mother died of breast cancer, her auntie died of breast cancer, some of her other relatives died of breast cancer. So it was obvious that there is likely genetic underlying to this
Yeah.
breast cancer. She got herself screened for these genetic mutations and she was found to be positive. She took a proactive step to have mastectomy done. Her two breasts were cut off, and later on she also had bilateral oophorectomy done. Her two ovaries, they were removed to reduce her chances of coming down with like breast cancer or an ovarian cancer at all, due to the genetic mutation that was found. So that shows you the importance of screening. She's living fine now. She's a strong advocate when it comes to creating awareness for breast
Breast
cancer
cancer.
screening. So that's a non-modifiable risk factor, genetics. Another non-modifiable risk factor is a family history, like I've said, either someone's mother or father or any other first relative has had breast cancer in the past. You can't change that. It is non-modifiable.
Yeah.
So for someone that has had breast cancer in the past, you mean the person probably has had breast cancer in the right breast and had the right mastectomy done. There's an increased chance of the person coming down with breast cancer in future in the left breast, about 1 to 2%
Wow.
chance of coming down with breast cancer on the other breast, because the person has had breast cancer in the past, he or she cannot change that. So I've talked about family history, but then someone who had early menarche, you cannot change that. Or someone who had late menopause, you cannot change that. Those are non-modifiable risk factors. But when we talk about modifiable risk factors, they include diet, they include lifestyle, they include our exposure, some certain radiation, they include our exposure to hormones, hormonal exposure, talk about hormonal replacement therapy. Some people have talked about oral contraceptive pills, exposure to hormones generally. Then age at childbearing, breastfeeding. People who start giving birth early at a earlier age have reduced chances of coming down with breast cancer compared to delayed childbearing. And people who breastfeed their child for 1 year or more have reduced chances of coming down with breast cancer. Lifestyle, talk about smoking, consuming alcohol. Weight, obesity is a modifiable risk factor too.
Okay.
You can work on the weight gain, and that's a modifiable risk factor. And our food that are high in unsaturated fat increases the risk, and food that are also high in processed foods, highly processed foods, they increase the chances of coming down with breast cancer. But consumption of vitamins in form of vegetables or fruits, they decrease the chances of coming down with breast cancer.
Okay, thank you so much. So I think that the response you just gave would bring this question. Now, you talk about diet and lifestyle. You know, when you talk about diet, looking at our present economy, like it's very funny. And with T-Pain, I actually don't know what that means, but everywhere, looking down. Okay, looking at the economy, do you think is workable for people who cannot even afford a normal meal and now stressing healthy meal? How do you think, or are there alternatives at which people can still eat healthy with still the little they are getting?
Okay, yes, certainly it is very difficult these days to
Yeah.
get a meal to eat at all. Not to talk
Talk of
of eating a balanced diet or an healthy meal. So, and we all know that poverty is tied to poor health.
Yeah, that's
Where
true.
you have poverty, you will likely find poor health indices. So when the earning power of people has been reduced, so it is very possible for you to start seeing some health conditions that are also associated with like eating unhealthy diets. But it is very possible that with the little we still have, at least try to make our meal. Let's try to make our meal healthy.
Okay.
You don't have to start consuming a lot of processed sugar,
And the
highly
truth is,
processed
people even
foods.
spend more on those processed food than eating healthy.
They are more costly. They cost more.
Yeah,
actually. So you have to try as much as possible to make sure that whatever food you are eating is something that will reduce your risk of coming down with some of these health conditions associated with unhealthy diets. And as much as possible, people who consume alcohol, reduce alcohol consumption if you can't stop it.
Yeah.
And it's advisable to stop smoking. Because smoking also increases the risk of breast cancer.
That's true. Okay. Thank you so much. So now moving forward, there are some misconceptions about bras and all of those things. Some will tell you when you wear bra that are very tight, you are at lower risk, of going down with breast cancer. Some have to wear the bra from morning till night, sleep with bra so that they are prevented. And some will say not wearing bra is a way of preventing that. When you wear bra, the ions and some of those, there are so many things. So I don't know. You are an expert in this, so let us know which is true, which is not true actually.
Okay, like you said, many of these things are misconceptions. They are
yeah.
talks that are not backed by evidence.
No evidence.
Because we've not seen evidence to support the rumors that, okay, when you wear a tight bra, it increases your chances of coming down with breast cancer. Or when you wear bra, or maybe it increases your chances of coming down with breast cancer. No, wearing bra is is more of a comfort thing. What is convenient for you? What is comfortable for you? So if you are okay with wearing bra, please do wear bra. Even if you feel it's not advisable wearing it to bed, but some people are comfortable doing that. Doesn't mean it increases their chance of coming down with breast cancer. But we won't advise that you do something that is uncomfortable for you. So it's a thing of comfort. So that tight bras increase the chances of coming down with breast cancer, that is false. There are other misconceptions. Some will tell you maybe some people who are 50 years and above that come down with breast cancer. That is false. Some will tell you that maybe sucking the breasts helps to prevent breast cancer. Or when a man help you massage your breast. Don't let Femi lie to you, please.
I think this is going to the men. It's going to the men. The way talks about it
Yes,
more, actually.
okay. Don't let Femi deceive you. I'm sorry,
Femi,
Femi, you're out there.
actually,
Okay,
that's
so
true.
well, though it doesn't. There is no fact that has proven that maybe when your breast is sucked out, it reduces your chances of coming
Chances.
down with breast
True.
cancer, or when a man massages your breasts.
Reduces.
Yes, we are not saying you should deny your husband, your partner,
Yeah.
of doing that, but that should not be the motivation behind you
Same
allowing.
because someone is pressing it.
Yes, yes, yes.
True.
We hear a lot of that. So, but try to do self-breast examination. But often, sometimes to be found that it may be possible that the changes you don't notice if you have someone, a partner who is intimate to you, he or she may be able to
Examine.
notice it.
All right. Thank you. So, last question before we wrap up. Now, how do we self-examine the breast? I think this will help a lot of ladies or partners, maybe husbands, who will be seeing this. It can help them know how to examine the breast of their wives, their partners, and even for the female themselves, and also for the males who might be at risk.
Okay, well, doing self-breast examination, I will do a quick description,
Okay.
but I would also, it would have been more comprehensive if I had a breast mannequin here,
Yeah.
which I
Okay.
can actually demonstrate with.
Okay.
But I don't have that here.
Okay.
But I will advise that people go online. There are a lot of educating videos online that you can watch on how to do a self-breast examination. And if you start practicing, you get better at it. But for a quick description of what a self-breast examination looks like, for women, it is advisable that at least, because there are hormonal changes that occur in women every month,
Yeah.
from ovulation stage to the premenstrual stage to the menstrual stage
True.
to the beginning of another cycle. And some of these hormonal changes also influence the breast.
Breast. Okay.
At some stage, some ladies will tell you their breast gets engorged, they are having some pain in the
Pains, yeah.
breast, their breast is more sensitive at that period. So it is beneficial that you pick a particular time of the month during your cycle when you do your self-breast examination,
Okay.
so that would be consistent. And it is advised that you make it a week after your menses are stopped.
Okay.
So 1 week after the menses are stopped every month, you do a self-breast
self-breast
examination. So self-breast examination involves you inspecting, and it also involves palpation.
Okay.
What do I mean by inspecting? You look. You start in front of the mirror as much as possible. You look at your own breast. Is there any changes in the nipple? You raise up your hands behind your ear. Is there any noticeable, looking at the mirror, is there any noticeable changes? Any noticeable in the nipple? Any changes in the skin? Is there dimpling of the skin, or is there a change in the size of one breast drastically compared
To the other.
or compared to what you used to know? Is there any, is one side looking lumpy? Yeah. So you look, anything you can feel, you try to observe. Then, of course, when it comes to palpation, there are different places that you palpate the breast itself.
So I want to
your
ask,
axilla.
how many?
Yes, you can use 3 fingers
Okay.
for many people, because that makes it easier for you to palpate than using the whole hand. So using 3 fingers is easier for you to pick. For a small size mass or lump, it's easier for you to detect with that. So in front of the mirror, you go circular motion. The hand on the other side, use it to palpate the particular breast, which means I'm using my right hand to palpate my left breast.
Okay, so it doesn't have to be this hand on the right
this
breast.
May be difficult, so it's easier to your hands comes more forward this way, and it's more comfortable this way. So you palpate like this in a circular motion. You can go clockwise.
Okay.
Palpate your nipple. the areolar region, palpate towards your axilla, your armpit, check your armpits, then check below your
Shoulder.
clavicle
Okay.
also.
Okay.
Check below your clavicle, just below your shoulder, then on top of the shoulder too.
Oh.
This pit.
So it's not only the
Because
breast
not just the
itself
breast,
that should
because
be.
when some of these changes start happening, there are organs in our body that we call lymph nodes. They react. They can number one, breast cancer can spread to these lymph nodes, and these nodes, because there might be increased drainage from those lymph nodes, they react to the cancer,
Okay.
to those changes. And in fact, in some people, it has been noted, it has been documented that in some people, it's even the changes in these lymph nodes that become first noticeable. A lump or anything might not even be so noticeable at the first place. So you can also lie down
to check
to
on
also palpate your
Okay.
breast.
Okay. Wow. Thank you so much. It was really nice having you on the show. So just
It's my pleasure to be here.
thank you, and I think this will be a light to so many persons to be able to know how to self-examine and also check themselves. So before we go, just your final words
I'm
to
very
people.
sorry, I forgot to mention, in
Okay.
the process of examining, palpating too, you have to try to press and milk out the nipple to see if there's any abnormal
Fluid.
discharge
Okay.
coming out. That is very important.
Okay. Thank you. So what are your final words to our listeners? What would you tell them?
My final words to everybody listening to me is that breast cancer occurs in both male and females. It is commoner in females, but it occurs in males. So if you are a male, you feel there's any changes in your nipple that is looking abnormal, please have it checked. Go see a physician, have it checked. And for females too, it is very beneficial that you learn how to screen. You are conversant with your own breast. You pick a day during your monthly cycle or every month that you self-breast, examine your breast. And for people who have a regular cycle that comes monthly, it is advisable that a week after your cycle, you do your self-breast examination. You can also have a clinical breast examination done where you visit a clinic and the physician or the nurse, the health practitioner on ground, examines your breast for you. And for people who are 35 to 40 years and above, it is beneficial. For 30 years and above, it is beneficial that you have a scheduled mammography. You can start having it every 2 years at some point. Then you can reduce it to yearly as the person advances in age. So mammography, for some people, your doctor may want to screen further with maybe you have an ultrasound done, depending on the person's condition at that point, or other radiological investigations or blood tests.
Okay, so thank you so much for joining us on the show.
My pleasure.
It was nice having you. So to our listeners out there, breast cancer can happen to anyone. We do not pray for such, and it is important that you self-examine yourself. Go for clinical examination, go for the mammography, just like our experts have said. And for people who might be survivors or even diagnosed of it around you, we can help them by supporting them in the process. It doesn't mean that you just let them or leave them in their own world. It is important. Yes, no stigmatization.
I think that is what keeps many people hidden, and then
they don't even talk about it very late. Yeah. So it is very important that you support people around you, be part of the process, learn from that process, whether you are a male or you are a female. And this is what we do with our podcast, giving health information, and that is why we are doing this, so that you are safe, so that people around you can be safe. And I would say a very big thank you once again to our guests. Thank you so much for joining us, and I hope you enjoyed the conversation.
I really did.
Thank you so much. So please do well to prioritize your health. It is very important. Do well to prioritize it. Your health, they say, is wealth, so it's very important. And don't forget to like, comment and subscribe on our YouTube channel, and also follow us on Spotify so that you can get reminded and notified whenever we have a new episode of our podcast. I'm still your girl, Double Mike, and I'll see you in the next episode. Thanks and bye.